My name is Tim Album, and I am the president and owner of Health Coverage Solutions. Today, I'm here to teach everyone all things Medicare. Stop the confusion. Okay, a lot of you are getting ready to turn 65. You're getting tons of information in the mail, tons of phone calls. All that information is either designed to get you to buy one particular plan or to confuse you. Okay, today I want to stop that confusion. I want to answer the questions of what should I do, how should I do it, and how much does it cost? Okay, I want to eliminate the stress, simplify the process, make this easy for you. That's why the name of this webinar is Medicare Made Easy. Now, getting everything set up correctly is extremely important. We want to make sure everyone makes a well-informed decision. We also believe that your Medicare plan option is very personalized. So what might work for your neighbor or a family member in another state might not work the best for you. Okay, we want to personalize this plan to fit your individual needs. Now, there's a few bookkeeping items that I want to go over before we really get started. Okay, I want to make sure that everyone has a pen and paper so they can take notes. We're going to go over a lot of information today, and I want to make sure that you can write down all that information, take notes on any questions that you may have that you can talk to our team members or me about after during your one-on-one consultation. Now, about that one-on-one consultation, anyone who completes this webinar in its entirety and sets up a one-on-one consultation with me or my team is going to get 2 bonus items. Okay, we're going to provide a Medicare cost analysis that's personalized to you. We're also going to give you a personalized Medicare roadmap. That's going to give you the dates that you should do your enrollments along the way. 2 very important and valuable items that I hope everyone takes advantage of just by setting up a one-on-one consultation with my team. Okay, so let's get going here. Some of the questions that we're going to get answered today. How do I know if I'm eligible for Medicare? Can I have other insurance along with my Medicare? What does Medicare cover? What is the difference between original Medicare and Medicare Advantage? And what if I plan to continue working post 65? A little bit about myself. Again, I'm Tim Album and I'm the owner of Health Coverage Solutions. I've been in the life and health insurance field for 23 years. I started Health Coverage Solutions back in 2010. I got my start in the life and health insurance field following in the footsteps of my father. My father's been in this business for 35 years. A lot of the information that you're going to learn today is information that I learned from him. I have a degree in finance from the University of Central Florida. I think my degree in finance and my financial background helps me explain 2 of the most important aspects of insurance: risk and financial exposure. I'm a numbers guy and I really enjoy simplifying all of the terms and things about insurance that confuses people the most. Co-insurance, deductibles, co-pays. I'm very good at simplifying those things, and when we talk on a one-on-one basis, I can simplify those and walk you through those processes and make them very easy for you. In addition to being the operator of Health Coverage Solutions, I am on the executive board of a local hospital here in South Florida. Now, I have experience in all types of health and life insurance products, but educating seniors about Medicare is my passion. I live in South Florida, in Parkland, Florida. My office is located in Coconut Creek, Florida. We are not just a Florida company though. We can help everyone nationwide. My team members are licensed in all 50 states, so we can help you anywhere, anytime. Now, I want to talk about my team. I have an amazing team. Without them, we wouldn't be able to do this webinar and help so many people. Any of you could be talking to me or any of my team members. In specific, I want to call out my 2 team members who help me in office, Lane and Phyllis. They are 2 amazing people that if you become a client of Health Coverage Solutions, you'll probably deal with them along with me. They really help me and I couldn't do this without them. This picture up here in the left is a picture of my family, and this is the reason why I work so hard and help so many people. My wife, Alyssa, and my daughters, Jenna and Cameron. If you can see, I'm completely outnumbered. I'm a girl dad. I do love every minute of it. My 2 daughters are extremely busy teenagers, and my wife is the one that holds all of our schedules together. My wife, Alyssa, we've been married for 19 years. It's been an incredible journey with her, but these are my why. I grew up in a family business, a family insurance business, so I enjoy having my daughters help me sometimes with my business if they can. We started a YouTube channel, it's called Medicare Dad, where we answer questions about Medicare. They're involved, we try and make them fun. If you want to write it down and view some of our videos and give us a like or subscribe, it's at Medicare Dad on YouTube. Why would you use a Medicare advisor like myself? I can search multiple carriers and find a plan to meet your specific needs. Okay, there's a big myth. There is no fee for my services. I do not charge an hourly wage. I'm paid by whatever carrier that you choose. So there's no fee that you have to use to take advantage of a broker like myself. There's also no difference in the coverage or the price by using me or buying it directly through the carrier. What you are gonna get with me and my company, Health Coverage Solutions, you're gonna get top-notch customer service. We're gonna service all of our policies. We have a team in place to handle all those policies. So you have a question about your coverage, you call us directly. No waiting on hold with carriers. We're gonna handle all that information for you. Now, why do I think I'm important as a Medicare advisor? Okay, I'm gonna provide ease and access to care. I wanna make sure that you can use the provider that you wanna use when you need to use them the most. Okay? I'm also going to provide financial stability. I want to teach you where the gaps are in Medicare and how to eliminate them. I also am going to do my best to make sure I keep your premiums stable and keep them stable for the life of the policy. Some 2025 Medicare stats that I just want to go over with everyone. Medicare is our version of socialized healthcare. All of you have been working your whole entire lives for this plan and paying in to get Medicare. It's something that you should be looking forward to, getting the best out of your Medicare benefits. Me and my team are gonna help you find those best options, but I just wanna go over some information about what Medicare has to offer, as well as some facts on Medicare. There is 65 million Americans enrolled in Medicare. It's about 25% of our population. California has the largest enrollment, followed by Florida. Currently, it stands for 10% of our federal budget, going to increase to 18% in 2032. That's solely because 14,000 people are turning 65 every day. For all of you that born in 1960 that are turning 65, this is the largest enrollment year that Medicare will ever have. The next 5 years, there's a ton of enrollees going on Medicare. I believe it's 15 million people will enroll in Medicare in the next 15 years, but 2025 is going to be the biggest year. All the baby boomers. So congratulations, you're the record breakers this year. Now, what to expect this afternoon? We're gonna learn about Medicare basics. We're gonna stop the confusion. We're gonna learn about the parts of Medicare. We're gonna learn about Medicare Supplements, Medicare Advantage plans, Medicare Part D. We're gonna learn how to enroll, when, how much, how do you pay for it. Any questions, please write these down when you set up a one-on-one consultation with me or my team, we can answer any of these questions that you have, okay? We'll personalize all of them for you and take our time to make sure we answer absolutely everything for you. Getting started with Medicare, okay? How do you qualify for Medicare or know if you qualify? You or your spouse qualify for Medicare Part A at no cost and Medicare Part B for a monthly premium if you worked 40 quarters, okay? Sometimes that's a little bit confusing for people. It's if you or your spouse worked 10 years. If you were a homemaker and didn't work, but your spouse did, you can draw your Medicare benefits off the fact that they paid federal income tax, okay? Now, Medicare, if you qualify, is going to start on the first day of your 65th birth month. If you turn 65 on the first day of a month, you're gonna get a bonus month. Medicare is gonna actually give you your Medicare a month early. So if you were born on September 1st, you're going to get your Medicare on August 1st. Now, what I also wanna bring up here, anyone that is currently enrolled or drawing Social Security benefits does not need to do anything. You are automatically going to be enrolled in Medicare. They'll send you all your information. They're going to deduct your premium directly from your Social Security check every month, okay? Now, if you are not drawing Social Security, you can enroll in Medicare 3 months prior to your 65th birth month the month of, and 3 additional months after. Okay, this is super important. If you don't enroll by the end of that 3rd month, you will be locked out of Medicare and they're going to charge you a pretty hefty penalty when you have a chance to enroll again. Okay, so make sure you do that enrollment in a timely fashion. Now, how do you enroll? There is 4 ways to enroll. You can mail in an application. You can do it over the phone. You can do it in person, or you can do it online. Now, the first 3 ways I wouldn't recommend. I wouldn't recommend sending in a paper application. Calling over the phone, you're going to wait on hold for a couple hours. Then they're going to call you back 6 to 8 weeks later to do your enrollment. Just very time-consuming. Going into the office, wouldn't recommend doing that as well. You may not get to meet with one. It's a long wait. The easiest way to enroll in Medicare, and I want everyone to write this down, is to create an account on ssa.gov. There's a wealth of knowledge on ssa.gov anyways. You can see how much your retirement benefits are, when you can retire. It's a wonderful website that everyone should have an enrollment in. When you do that online registration, you can do your Medicare application from there. It takes 10 minutes. Me or my team can help you set that up and do that application. Very easy process, and we'll help you do that as well. Okay, now, how much does Medicare cost? Medicare Part A has no premium. Medicare Part B for 2025, the standard premium is $185 per month. Now, that amount could be affected by your income. Okay, that's why I have below here this fancy term. It's called IRMA, Income Related Monthly Adjustment Amount. If your income is above $106,000 if you file single, or $212,000 if you file jointly, they will charge you more for your Medicare Part B premium. Okay, they're going to base that on your modified adjusted gross income from 2 years back. So in 2025, they're going to base that on your 2023 federal tax return. Okay, it's line 11 on your tax return. So if anyone wants to look at that number, again, write all that information down. Part of our Medicare cost breakdown for you, if you set up that one-on-one consultation, we'll have all of this information for you. Okay, now how do you pay? If you're drawing Social Security, the premium's automatically going to come out of your Social Security. If you're not, you're going to be billed quarterly for your Part B premium. Now, if you want to set up an auto pay or a reoccurring payment or pay on a credit card or out of a health savings account that you've had all those years, you can write down another website, mymedicare.gov. Now, that's a wonderful site that you should also have access to, that's going to give you information on all the plans available, prescription drugs, preventative care. You can track your claims there, but you can also pay your premiums. You can set up a reoccurring account out of a credit card or out of a checking account, or you just can go and make manual payments from there. Now, what if you plan to continue working post 65? It's a big question that a lot of people have. Well, Medicare says if you or your spouse are working and currently on employer-sponsored drug coverage, you can defer your Medicare until you stop working. You'll have a 7-month window to do so to enroll in Medicare. It will be just like you were enrolling as if you were 65. Now, Medicare has a few restrictions on this. If you are working and you work for an employer who has less than 20 employees, you are required to enroll in Medicare Part B. Now, if you want to stay on your employer-sponsored coverage or go on Medicare, is a very important decision. There are a ton of factors that you should consider. Those factors of if you should stay on your employer-sponsored group coverage or go on Medicare come down to what is the premium that you're paying each month out of your check for your Medicare plan. Is your spouse on the plan? Is that affecting the premium that you're paying each month? What are your deductibles? What are your co-pays? Are you having a hard time using the doctors that you want to on your current plan, having a hard time getting prescription coverage? Those are all factors that you really want to look at. That's something that me and my team will break down for you in that one-on-one consultation, showing the cost of what a Medicare plan would cost versus what your current coverage has. Now, again, if you decide to continue on your employer-sponsored coverage, then when you stop working, you will have a 7-month window to enroll in Medicare. There's 2 forms that you have to fill out and submit to Social Security. All this information is information that we can get for you and help you do once you decide to stop working. Okay, so now we're going to talk about what is covered by Original Medicare. Okay, there are 4 parts of Medicare. A lot of people get confused by parts versus plans. They all have letters after them. It makes it very confusing. Here's the cardinal rule that you should always go by. Parts, those are what you've been working for your whole entire life and are what you're entitled to from the federal government. Plans, those are offered by private companies like a Plan G Medicare Supplement. That's a secondary plan that you would get in addition to Medicare. But the parts of Medicare are what you're entitled to, and there's 4 parts. Okay, you have Medicare Part A, which is going to cover hospitalization. It's going to cover inpatient room and board, skilled nursing, home health care, and hospice. Okay, Medicare Part B, which is the medical portion of Medicare. Okay, that's going to cover doctor visits, inpatient, outpatient surgeries, preventative care, ambulance, emergency care, imaging, lab work, DME, which stands for durable medical equipment. Do you need a walker? Do you need a wheelchair? Do you need a sleep apnea machine? All of those would be covered by Medicare Part B. Now, Medicare Part B will also cover a limited amount of medications. Okay, Part B will cover chemotherapy medications, which are very expensive. It will cover the cost of those. It will also cover the cost of any medications that are infused in a doctor's office. There are a few conditions, rheumatoid arthritis, irritable bowel syndrome, are conditions which are treated very effectively with infusions. Those infusions are very expensive. They are administered by a doctor in the doctor's office, and Medicare Part B will cover those infusions. Okay, now when you use Medicare Part A and Part B together, it's also referred to as using Original Medicare. When you use Original Medicare, you can use any doctor, any hospital in the country that accepts Medicare. You have nationwide coverage. Okay, now we're going to skip Medicare Part C and we're going to go to Medicare Part D. I think it makes it easier for me to explain Medicare Part C. Medicare Part D is prescription drug coverage. Prior to 2006, Medicare didn't cover outpatient drug costs at the pharmacy. So this was a game changer. Okay, now Medicare Part D plans are funded by the federal government, but they are administered by private plans. You can either get your Part D coverage through a standalone plan or through a Medicare Advantage plan. We're going to go a lot more into Medicare Part D towards the end of the webinar. So any questions you have on that, just hold on. We're going to answer a bunch of those towards the end of the webinar. Now we'll go back to Medicare Part C. Medicare Part C is Medicare Advantage, and it is a private plan that you enroll in that replaces Parts A, B, and D and combines them into one plan. Now, these plans are required to cover the same core benefits that Medicare covers at different levels, but they have to cover the same benefits that Original Medicare would cover. Now, Medicare Advantage can also add some of the benefits that are not covered by traditional Medicare, dental, vision, hearing. We'll get a lot more into that later on in the webinar, but that's what Part C plans can cover. Now, how Medicare Parts A, B, and D work together. I'm going to use a knee surgery example here, and I'll try and stay with this knee surgery example throughout the webinar. I think a lot of you might have been putting off a knee surgery until you go on Medicare. It's going to be covered very well, a lot better than an individual plan or a group plan. So I think it makes it easy to explain. Now, with a knee surgery, you're probably going to be hospitalized for a few days. You're going to need some follow-up treatment, prescriptions, maybe some equipment. So it's a good way to explain how Medicare is going to cover that procedure. Now, Medicare Part A would cover the cost of the hospitalization for all the days that you were hospitalized. It would also cover the skilled nursing facility if you needed to go to a rehab facility after the surgery. Medicare Part B would cover the cost of the surgeon, the anesthesiologist, any of the follow-up visits that you had with orthopedic, physical therapy. It would also cover if you needed a scooter or a walker to help you get around. It would pay for that equipment. Now, Medicare Part D would cover the cost of any of the medications that you had. Did you need an anti-inflammatory, an antibiotic, or a pain medication? Part D would cover the cost of those. Okay, so now we know what is covered. How is it covered? Okay, we're going to find out what the gaps are, and we're going to find out how to eliminate those gaps. Medicare Part B coverage. Okay, we're going to go over how it's covered by Medicare Part B first. Okay, I think you're going to use Medicare Part B a lot more than you use Medicare Part A. In 2025, Medicare Part B has an annual deductible of $257. After that deductible, Medicare is going to cover 80% of your cost. You're going to be responsible for 20% of those. Now, Medicare Part B will cover some preventative services as well as lab work at 100%. But I do want to bring up here that if you're just using Part B by itself with original Medicare, there is no cap on your out-of-pocket expenses. Okay? So if you have a $100,000 bill, you're going to be responsible for $20,000 of that, or 20%. Now, you can get plans that will pick up this 20%, whether a Medicare Supplement or a Medicare Advantage plan. These are all the things that we can go over in our one-on-one consultation when you set that up with my team. Now, just like with your insurance you have at work or an individual plan, Medicare Part B has an approved amount. When you use your insurance now for a procedure and there's a big bill, $5,000 bill, but the insurance company pays $1,000 on it, Medicare does the exact same thing. It's called the Medicare approved amount. Okay, we're going to use this knee surgery example again here. Let's say your doctor submits the bill to Medicare for $30,000. Medicare says, no, we only approve $20,000 of it. Now, you're only ever responsible for what Medicare allows. That difference, that $10,000 difference, just disappears. Now, Medicare is going to pay on the approved amount. So they would cover 80% of this $20,000 expense, or $16,000. Now, your responsibility in that situation would be 20%, or $4,000. Now, Medicare Part B also has another caveat. It's called Part B excess. That's if our doctor or a hospital chooses not to accept Medicare assignment. By law, that provider can charge 15% above Medicare's approved amount. You would be responsible for 100% of this amount. In this example here of that $20,000 claim, they could charge you 15% above that, or another $3,000. Now, there are supplemental plans that would pick up that extra charge, okay? That Part B excess charge. When you set up a one-on-one with my team, we can go over all those with you. Plus, we're going to review that during the Medicare Supplement portion of the webinar, which is coming up here in a minute. Now, Medicare Part A, your hospitalization coverage, your skilled nursing facility coverage, your at-home care coverage. Unlike Medicare Part B, which has an annual deductible, Medicare Part B has a deductible for every 60 days of hospitalization. Okay, that deductible can be met up to 5 times in 1 year. Medicare Part A has a deductible. That deductible, your first day in the hospital, would be $1,676. Now, Part A works in a 60-day cycle or benefit period. At the beginning of each cycle is that deductible. If you go 60 days without a hospitalization, you would have to pay that deductible again. Okay, I have some other examples over here that help explain it a little bit easier. So we have that first example where you're in the hospital for 5 days. Okay, now let's say we take that same example. You're in for those 5 days. You go back into the hospital on day 66. Okay, you went 60 days without a hospitalization, so you'd have to pay that $1,676 deductible again. Now, let's say you were in for those 5 days, you were discharged, but you went back into the hospital on day 59 and you were hospitalized to day 70. Okay, day 59 and 60 would have been covered under your original deductible, so you wouldn't have any cost, okay? But days 61 through 70, you would have to pay the copay of $419 per day. Now, from this 70th day, you would now need to go 60 days without a hospitalization in order to restart everything. If you didn't go 60 days, you could fall into your lifetime reserve days. Those are days 91 through 150, where you would have to pay $838 per day, okay? Once you use one of your lifetime reserve days, they're gone and you never get them back. Now, I make a big deal about these numbers, but I want everyone to not worry about them. If you get a Medicare Supplement plan or a Medicare Advantage plan, you are not going to incur any of these numbers. I just want everyone to be aware of what would happen if you just kept original Medicare by itself with no additional coverage. So Medicare Part A, $1,676 deductible that can be met up to 5 times in 1 year, every 60-day benefit period. Okay, now Medicare Part A also covers skilled nursing. Medicare defines skilled nursing as if you were hospitalized for at least 3 days. Within 30 days of your release, you're sent to a skilled nursing facility, a rehab facility. Let's say we use that knee surgery example and you had both knees replaced. Okay, you didn't need to still be in the hospital, but you needed someone to help you walk around, maybe help you in the shower, help you eat, do all of those things. All of those situations, those treatments will be done in a skilled nursing facility. Now, Medicare is going to cover the first 20 days in a skilled nursing facility 100%. Your responsibility for days 21 through 100 would be $209.50 per day. Now, a lot of people ask, why would I go to a skilled nursing facility when I can just do this at home? Okay, the extent of Medicare's at-home recovery benefits are very limited in the home. Okay, if you need the assistance from a nurse to help you get up, walk around, clean, all of those things, those are all going to be provided in a skilled nursing facility. Okay, so it is a cost that you could incur, and it's a cost that I find a lot of people on Medicare don't look to when they're planning for the future. Okay, there are very nice skilled nursing facilities, there are very not nice skilled nursing facilities. So just be very careful with that. Medicare will also cover hospice care. It will cover at-home recovery. The at-home recovery is limited to PT or wounds care. So again, a lot of that information, a lot of those services that you would need would be done in the skilled nursing facility. There could be a huge cost. Supplemental plans and Advantage plans will pick up that cost for you on very different levels, so it's something that you really need to look into. Okay, so now that we've talked about what's covered by Medicare, how it's covered, okay, we know what the gaps are, we know what your exposures are to what's not covered by Medicare and what the cost could be. Now we're going to learn how we get rid of those costs. And there's 2 ways to get rid of those costs, either with a Medicare Advantage plan or with a Medicare Supplement plan. I like to refer to this as good versus better. I think they're both great options. I just think one is a little bit better than the other one. It really just depends on what your individual needs are and what you want. We do offer both plans. Just really, again, it's a personal preference. Cost matters into, budgets matters into. So those are all things you want to take into effect. Again, these are all of the things that we can teach you in our one-on-one consultation that you can set up with us after this webinar. Now, I have an employer group plan that I provide to my employees. It is very expensive. There are big deductibles, big copays. I would take either of these options in a second. It just depends on, again, what your preference is. Now, a Medicare Advantage plan is a private plan that's going to replace your Medicare. Okay? It's going to be available per the county that you live in. So the plans are going to vary county by county. You're going to need to use a network, okay? Except for emergency care, you can usually join either an HMO or a PPO type plan. Plans are going to have a gatekeeper or require prior approvals for surgeries or for tests. If you need to get that knee surgery done, the Medicare Advantage plan might require you to do some PT prior to that surgery being approved. Now, a Medicare Supplement plan, now again, it's a private plan that you're going to carry in addition to Medicare. There's no network. It's nationwide coverage. You can use it wherever Medicare is accepted. There's 10 standardized plan options, and you never have any prior authorizations with the plan. Okay, whatever your doctor orders, you can go ahead and do. Now, back to the Advantage plan. Again, the Advantage plan typically going to have 0 premium in addition to the Part B premium. We're going to continue paying that, but no additional premium after the fact. A Medicare Supplement plan is going to have a monthly premium in addition to the Part B premium. Okay? Your Advantage plan, typically it's going to include your Part D prescription coverage. A supplement, you're going to need to add a standalone RX plan. Now, a Medicare Advantage plan in 2025 can have a $7,550 maximum out-of-pocket in-network and a $14,000 out-of-pocket maximum out-of-network. Okay? A Medicare Supplement plan typically is going to cap your expenses as per your monthly premium that you're paying. You may have some copays and some deductibles to meet, but typically you pay that premium and you don't have very much expense above and beyond that premium. Now, a Medicare Advantage plan can add some additional benefits that original Medicare doesn't cover. Dental, vision, hearing, gym memberships, grocery cards. Those all can be added to a Medicare Advantage plan. With a Medicare Supplement plan, you're not going to have those benefits. If you want to add the dental, the vision, those are going to be at additional cost on an optional basis to add to the plans. Some of the Medicare carriers that we represent here at Health Coverage Solutions, we represent all the major carriers. Here's a list of some of the major ones that we represent. Again, it's going to vary depending on where you live in the country. We will try and offer you the best plans that we can find. We're only going to use A+ carriers so that you can be secure that the coverage is what you need and secure. Medicare Supplement plans, plans A through N, okay? These are all the standardized Medicare Supplement plan options. Now, you'll hear a lot of people refer to Medicare Supplements as Medigap plans, and I think that explains it a little bit easier because you are filling the gaps that are not covered by traditional Medicare. So all of these boxes here on the left-hand side represent a gap that's in Medicare, a coverage that's not there. Okay, this first box here, Medicare Part A coinsurance and hospital coverage up to an additional 365 days. Those are all those scary copays that I just showed you in the hospital. Okay, if you see, all the plans pick up those charges. Medicare Part B coinsurance, that's the 20% that's not covered by Medicare. All the plans are going to pick that up. Some of the plan options pick that up on a percentage basis. Some of them give you some copays for some certain services. Blood, Part A hospice, skilled nursing facility charge. That's the days 21 through 100 where you're responsible for $209.50 per day if you're in a skilled nursing facility. If you see, there are plans that pick up that benefit. Part A deductible. That's the $1,676 deductible that can be met up to 5 times in 1 year. All plans B and above pick up that deductible if you were to incur it. Part B deductible. That's the $257 annual deductible that's not covered by Medicare. If you enrolled in Medicare after 2020, which most of you are, you cannot have a plan that will pick up that deductible. There are a couple plans that pick it up, plans C and F, but those are only if you were eligible for Medicare prior to 2020, okay? So Part B excess charges, that's that 15% that we talked about earlier, that the doctor can charge if they don't accept Medicare assignment, Part B excess. There is a plan that picks it up, Plan G. I don't think that that's a huge expense to worry about, but some people really want that covered, and you would want a Plan G to cover that expense. Foreign travel emergency, traditional Medicare will not cover you if you're out of the country. There are supplemental plans that will pay a benefit if you're out of the country during the first 60 days of a trip. They're gonna pay 80% up to $50,000 over the life of the policy. So Medicare Supplement plans. You're buying a Medicare Supplement plan for stability. Okay, these plans are guaranteed renewable for life. They can never be changed. Different states rate the premiums in different ways. It's all determined by your state insurance commission. They're either issue age products, okay? Attained age product or community age. Now, I can get into this on a one-on-one basis with everyone. We're not gonna get too in-depth in it. Issue age means you keep the same age for the life of the policy. Attained age means your premium goes up every year as you get older. Community rated means a state that's going to lock in the premium for everyone, no matter what age they are. All different factors go into that, and there is positives and negatives to all of them. Okay, now there's no underwriting on a Medicare supplement policy 6 months before turning 65 and 6 months after. The same comes into effect if you're retiring post 65, okay, and starting your Medicare later, 67, 68, at whatever date, you would be entitled to those same underwriting guidelines where you can't be underwritten 6 months before and 6 months after your Part B effective date. Okay, it's like being able to buy homeowners insurance when your house is on fire. They can't ask you any health questions. They can't have any pre-existing limitations. Now, I bring this up because a lot of people look at a Medicare supplement plan and they're like, that's a great option. I'm just going to purchase that option when I need it. You can't do that. These plans are medically underwritten. A lot of people, since the advent of the Affordable Care Act, where there is no medical underwriting, think the same thing applies to a Medicare supplement plan. That's not the case, okay? You can and will be declined due to medical conditions if you don't enroll during your guaranteed issue period, okay? These plans are portable. You can take them with you wherever you go. Are you going to travel a lot? Do you live in 2 different places? These are the type of plans that you want to have for the flexibility. Now, all the plans are exactly the same. They're standardized. So whatever company is writing one of these plans, the coverages have to be exactly the same. So why not just buy the least expensive option? Well, that's where someone like me and my team comes in. Okay, we're going to look at all these numbers. Buying the least expensive is not always your best option. You want to make sure that you're choosing a highly rated company with a long track record in your state, lots of current clients, always adding more, and a very good claims loss. Okay, these are things that we track all the time. Premium increases over the life of the policy. There are carriers that come into a market and give a very low rate to try and take a bunch of business, okay? A year, 2 years down the road, they raise the rate significantly, okay? The people who have a lot of health conditions get stuck into those plans. I don't want that to happen to you, okay? I wanna make sure that you're in a company whose premiums are competitive now, but also are going to stay affordable for the life of the policy. I don't want you to get stuck in the wrong plan. Now, we talked about Medicare supplements. Let's now talk about Medicare Advantage plans, okay? Your other option. Now, a Medicare Advantage plan is a private plan that's going to replace your Medicare and become your primary. Some or most are going to have a 0 premium, okay? Now, how does that work? How can they offer a 0 premium? Medicare stops paying any claims on your behalf if you enroll in that Advantage plan, and they pay a certain amount per month per enrollee to that Advantage plan to manage your health. It's going to vary the amount they get on where you live, a lot of factors. The plans can get bonuses. There's a huge algorithm that helps determine this, but that's how you can get a plan that has 0 premium in addition to the Part B premium. Okay, again, these plans are going to replace your Medicare and become your primary. The plan is going to have co-pays, co-insurance amounts for all of your services that will all go to a maximum out of pocket for the year. In 2025, that maximum is $7,550 in network. Now, a lot of Medicare Advantage plans are going to offer a maximum out of pocket that's significantly lower than that, but that's the highest that Medicare does allow, and that does change on an annual basis. Okay, now an Advantage plan will typically include your Part D prescription coverage. You can get an HMO or a PPO type plan. With an HMO, you're going to be required to use only in-network providers. You're only going to have emergency coverage out of network. A PPO will allow you to use in and out of network doctors. Now, a myth that I really want to bring up is people think when they enroll in a PPO that they have coverage everywhere. That is not the case, okay? With a PPO, you will not be able to see every provider. You will have out-of-network coverage, but not coverage everywhere, okay? There will be providers who won't see you on a Medicare Advantage plan. Now, there are also different types of Medicare Advantage plans. There are plans that offer a Part B give back. What that is the plan will pay you back a portion of your Medicare Part B premium. Some people have budget concerns and they need to get some of that Part B premium back, so there are plans that are offered. Now, the plans are going to offer dental, vision, hearing, lots of other benefits, again, that I talked about before that are not covered by our original Medicare. I do want to bring up two things here. Those richer benefits that are paying above and beyond what traditional Medicare covers are going to affect how your health care is received. These plans are giving you additional benefits, okay? It may have more restrictions on your access to providers. They may require you to do more prior authorization before a surgery. Just look at all of these. I want to make sure everyone purchases a plan or enrolls in a plan based on what they are worried about for the future. Don't buy a plan because of you're healthy today. You don't know what's going to happen tomorrow, so make sure that you're getting a plan that's going to cover your core health benefits. Please, please, please don't purchase a plan based on the dental. I've seen it burn too many. Too many people have gotten burned because they got the additional dental coverage. If the plan covers everything you need with your health and it has great dental, that's amazing, but just make sure your health is covered first. Okay, now we're gonna use this knee surgery example like we did with the supplement or original Medicare. With Medicare Advantage, you would need to get an authorization for the surgery. You need to make sure all the providers were in network. You would pay a copay, most likely, for every day that you were in the hospital, co-insurance for the surgery, a percentage of it. You would pay copays for all the follow-up doctor visits or the PT, as well as copays for your prescriptions. All of those costs would go towards your plan's maximum out-of-pocket for the year, which again, 2025, the maximum out-of-pocket you can have is $7,550. Pros and cons, okay? These plans both have pros and cons. We'll go over the Medicare Supplement pros and cons first. Pros, it's broad coverage, okay? You have the freedom to choose and it's a nationwide network. Predictable costs, you pay your premium, most of your costs are gonna be covered. Stability, your plan can never be changed. It's locked in. It'll travel with you. If you move, you can take that plan with you. The cons of a supplement, higher premiums. Again, you're paying a premium in addition to that Medicare Part B premium. Rate increases. You need to always look at your plans and make sure that you're not in a plan that's going to increase significantly because plans and rates do go up. You're going to need to add standalone RX coverage to your supplemental plan. And there's no additional dental or vision coverage you would need to pay for those coverages. Now, the pros and cons of the Medicare Advantage. Pros, it's all-in-one coverage, okay? Cost savings. You're not paying an additional premium like you would with a Medicare Supplement plan. There's extra benefits. The dental, the vision, hearing, all of those benefits can be included with a Medicare Advantage plan. Care coordination. If you have a specific illness, emphysema, heart disease, there are plans that you can enroll in. They're called special needs plans. These plans are tailored to someone who might have that chronic illness. You'll have nurses to help you out, manage your health, your doctor visits, your medications. It's just an added benefit that you could enroll in. The cons of the Medicare Advantage plans. There's network restrictions. Networks are constantly changing, okay? From year to year, your doctor may be in network one year, not in network the next. Same thing with a hospital, okay? Potential for higher out-of-pocket costs. Now, where I really want to bring this up, that $7,550 maximum out-of-pocket is an annual calendar year out-of-pocket maximum. Let's say you are going to get treatment for an illness or a condition that's going to last 6 months, and that starts in November. From November and December, you would have that $7,550 exposure. In January, that would start over again. So in a very short period of time, you could reach that maximum out of pocket 2 times. Just be aware of where those cost exposures are, okay? Another con of the Advantage plans, limited plan options. The plan options are going to be limited to the county that you live in or are going to be different from counties across the country. Also, the plans aren't portable. So if you move out of a county to another county or a different state, you're going to have to change your plan. That plan might not be available where you're moving to. My final thoughts on good versus better. We have thousands of clients, and here's what they comment the most, okay? Medicare Supplement clients are extremely happy unless they get a rate increase, and then they're not happy. Medicare Advantage clients are happy until they have to navigate networks and get referrals. You know, the last thing you want to do is jump through hurdles when you need extensive medical treatments. It's the last thing that you want to deal with. Now, we've had clients that have been extremely happy with both plans, how they've covered very serious medical conditions. It just basically comes down to what works for everyone individually is different from client to client. That's why we're going to personalize these plans for you. When you set up your one-on-one consultation with us, we're going to break down what the plan options are. We're going to ask you what you think you want. We're going to review your doctors. We're going to review your prescriptions. We're going to go over all those very personal things so that we can help you make a decision with what plan you want, okay? Now, my final thoughts on good versus better. What are the biggest issues that I come across? What bothers me, okay? Your access to care. When you cannot see the provider that you want to or need to see when you need it the most, that bothers me. I'm going to do my best to make sure that that does not happen to you. My team will as well, okay? I've trained my team that we want access for our clients. We want to make sure that they are never going to be blocked from seeing a provider that they need to see. Skilled nursing is a huge hidden issue. There are some very nice skilled nursing facilities. There's also some skilled nursing facilities that are not very nice. No one ever looks at a provider directory and goes and looks at skilled nursing facilities. Most people don't even know what they are, okay? Look at these things. What we find the most is it's not you that's coming to us when you have an issue with a skilled nursing facility, it's your kids or your spouse. I don't want to send mom or dad there, or I can't send my husband to this facility. Usually at that point, it's too late for us to make a change, okay? Most people don't know what they have until it matters most. We are going to make sure that that does not happen. And I will advise everyone here, when you're looking at plans and determining situations like that, don't just look and make sure your primary care and your dermatologist are covered. Make sure that providers that you want to use in the future, if something serious are to happen, hospitals, facilities, treatment centers, skilled nursing facilities, make sure that they're in network, okay? Because we don't know what's going to happen next month, 6 months, a year down the road. And that's what the insurance for is, to protect against the unknowns. Medicare Part D, okay? We're going to talk about Medicare prescriptions here. Medicare Part D has changed a lot from 2024 to 2025. It's gotten a lot better. Again, Medicare Part D is the prescription drug coverage offered by Medicare. There's private plans, either through a standalone plan or through a Medicare Advantage plan. These plan premiums are subject to IRMA, just like your Part B premium is. I'm going to show this chart here in a minute that will go over what the premiums are if your income is above a certain amount. Plans are going to have monthly premiums. They're also going to have formularies. Typically, those formularies are going to have tiers 1 through 5. Tier 1 being the least expensive medication, tier 5 being a specialty medication. Okay, plans are going to have a deductible, an initial coverage level up to a catastrophic level. In 2025, the maximum deductible a Part D plan can have is $590. Now, most plans waive that deductible for generic medications, and you just have to pay that deductible for brand name medications. In the initial coverage stage, you're either going to pay a copay or a coinsurance amount for your medication after that deductible. All those costs, that you pay are going to go contribute towards you reaching the catastrophic level, which is once you reach $2,000 in out-of-pocket cost, all of your medications are covered 100%. Now, this is brand new for 2025. Prior to 2025, there was no max out-of-pocket on your medication exposure. So this is a game changer. Now, we have seen the effects of this do some very good things as well as some negative things. You know, that out-of-pocket maximum is huge for people when it comes to budgeting their medications costs, specifically if you have very high medication costs. Okay, we have seen carriers, because they're taking on such a huge financial risk, they have tightened up formularies. They've made more expensive medications harder to get covered. So you need to really look at these plans and make sure your medications are covered. Again, this is something that my team as well as myself are going to break down for you. We're going to make sure that all your medications are covered. Make sure you have to jump through the least amount of hoops to get those medications covered. Okay, it's a full breakdown. In addition to your plan, we got to make sure your medications are covered as well. So in addition to the $2,000 max that was part of the Inflation Reduction Act, in 2025, there's a program called the MPPP. Now, what this plan does, allows you to spread the cost of your medication cost over all 12 months. If your medication costs are going to be over $600 for the year, you can spread that cost across the year to budget. Okay, so you might incur that $2,000 maximum in the first quarter of the year. Instead of having to pay that all up front, you can tell whatever RX carrier you choose that you want to spread that across 12 months. They will send you an invoice every month for those medications to help you budget for it. Now, Part D plans are subject to a late enrollment penalty if you don't enroll in one in a timely fashion. Just like enrolling Medicare, you need to do it 3 months prior, the month of, or 3 months after your 65th birth month. Now, or when your Part B starts. Now, a lot of people who aren't taking any medications say, Tim, why do I need to enroll in a Part D plan? Well, again, my expertise and my advice would be enroll in the RX plan. There are some very affordable options. We don't know what's going to happen tomorrow. We need that protection. We can get you a plan that's very low cost to cover those medications. And then if we need to adjust that plan each year moving forward, me or my team will do so. Now, talking about changing plans, enrollment periods, okay, when can you do certain things? Now, everyone here, or most everyone here, is in their initial enrollment period. The initial enrollment period for your Medicare starts 3 months prior to your 65th birth month, the month of, or 3 additional months after. Now, during that time, you can enroll in Medicare, you can enroll in a Medicare Advantage plan, you can enroll in a prescription drug plan, you can enroll in a Medicare Supplement plan. You actually can enroll in the Medicare Supplement plan 6 months before you turn 65. Okay? This is a one-time when you first go on Medicare that you're going to be able to do all those things. After this one time, okay, your initial enrollment period, each year you're going to run into the annual election period. Now, the annual election period runs October 15th through December 7th every year. That is a time period where you can change a prescription plan. You can change a Medicare Advantage plan. Now, a lot of people get confused with a Medicare Supplement plan. A Medicare Supplement plan is a private plan that you're carrying in addition to Medicare. It's yours. So you can change those plans whenever you want to. They're not subject to the enrollment periods. However, they are subject to underwriting. Okay? Big difference between the two. But the annual election period is a time where you're going to be bombarded with marketing from all different types of insurance companies wanting you to change your plan. We review all of our clients' plans for them to make sure that they're in the right plan now and for the next possible year. Now, there is also another enrollment period that's called the Medicare Advantage Open Enrollment Period. That runs from January 1st through March 31st. This is a fix-it period that was installed by Medicare. During the annual election period, you might have made a decision not knowing exactly what you were getting into. This is a fix-it period where you can change your plan. You can go back on the old plan that we are, or you can change to another one. It's a great time period that we're going through. to help our clients fix certain situations, okay? Now, a special enrollment period. A special enrollment period is if you move out of the area of your Advantage plan or your prescription plan, okay? You're gonna be granted a special enrollment period to change your plan. Also, a special enrollment period is when you retire from work, okay? And you need to enroll in Medicare. That's that special enrollment period, that 7-month window that you have to enroll in Medicare after you stop working and you're on employer-sponsored coverage, okay? Finally, the general election period. The general election period is for anyone who failed to enroll in Medicare in a timely fashion, who wasn't working and on employer-sponsored coverage. You're gonna pay a penalty. I hope no one has to deal with the general enrollment period, because I don't want anyone to have to pay a penalty. If you've watched this whole webinar and you're scheduling a one-on-one consultation with my team, that's not gonna happen. We are going to make sure we're gonna give you your Medicare roadmap that's gonna tell you what dates you need to do anything, what the deadlines are, so you'll never have to worry about paying any premiums or any late penalties on your Medicare premiums. Now, some ancillary products that we offer in addition to Medicare Supplements and Medicare Advantage plans. We offer Affordable Care Act plans if you need plans for a spouse and you're going on Medicare. We do offer some annuity products, life insurance, final expense, term life. We also offer cancer and critical illness plans, as well as hospital indemnity plans. Now, if you're gonna go on a Medicare Advantage plan, I think these are two types of plans that you really want to look at to help eliminate that maximum out of pocket, which could be a huge amount. A cancer or a critical illness plan could help cover that, as well as a hospital indemnity policy that's going to pay a certain amount per day while you're in the hospital. So you can use these to help offset some of the costs that you have. They're very affordable and a great addition if you want to go onto Medicare Advantage. Now, we do also offer in some states short-term home health care. That's a plan that will cover you for home health benefits, 90, 180 days. They're a lot more affordable than your traditional long-term care products. Again, if anyone wants to talk about these during your one-on-one consultation with me or one of my team members, we'll go over all of them for you. We're gonna spend as much time with you as possible. We've gotten to the end. Thank you so much for everyone that joined us for the whole entire webinar. What are the next steps? Okay? Set up your one-on-one consultation with us. There is a button to click right there on the bottom of the screen where you can set up that time right now. You can call us and schedule it with one of my team members. We advise setting the appointment up as soon as possible. If you set that appointment up, again, you're going to receive 2 free bonus materials: your personalized Medicare cost analysis, as well as your personalized Medicare journey roadmap with all of those dates so that you know you don't miss any of those important enrollment deadlines. Now, in addition to those 2 bonus materials, we do offer some things at Health Coverage Solutions that I want everyone to know about. We offer lifetime claims and premium service, okay? If you ever have an issue with a claim, we are going to fix that for you. We're gonna do our best to make sure that you're never in a plan that you're gonna have issues with, but sometimes that's out of our hands. If you need to have some issues taken care of, you give us a call. We are going to take care of that for you. I have a team in place that does that. I don't want you on hold all day. We have a special number that we can call and we can get that fixed a lot faster than you can, okay? We're gonna offer a annual plan review, okay? We're gonna make sure that you're in the plan that's gonna fit your needs as your healthcare changes, your prescriptions change each year. We're gonna do a plan review for all of our clients. We would do that during the annual enrollment period. And finally, we do offer a referral program. It's a program where we help out our clients that send new clients our way. We actually also help out those clients. It's a nice gift that we give to you, as well as the client that you referred our way. We call it the Inflation Reduction Rewards Program. We started it last year during the annual election period. It's a fun program that a lot of people take advantage of. Again, if you want to talk about this during your one-on-one with us, we'll do so. I want to thank everyone for joining the webinar today, Medicare Made Easy. I can't wait to talk to you all on our one-on-ones. Click that button down on the bottom or give us a call and we'll talk to you as soon as possible. Can't wait. You guys have a great day.